question we got. What are the different types of arthritis? And can you talk about tricompartmental knee arthritis? So go ahead, Ben, and I'll chime in as needed.
Sure. So maybe I'll address the images that we see here. We'll address tricompartmental knee osteoarthritis. So this is an issue that is commonly seen in individuals who have been suffering arthritis for a long time. This is a fairly severe case. So when you do have tricompartmental knee osteoarthritis, that means that the three compartments of the knee joint are osteoarthritic, decreased in joint space. And so the best way to visualize this is through an X-ray there. And so we can see on the left side of the X-ray that there's really nice joint spacing there. And you can see how it's got, and right where Clayton is just drawing those in there, you can see the dark spacing is beautiful, beautiful. So the medial and lateral compartments of the knee have great spacing. Something that we can't see here is the spacing behind the kneecap and the femur. So in tricompartmental knee osteoarthritis, that area as well would be osteoarthritic and would be decreased in spacing. And so a really good image is the right side there, where you can see that there's just no space there. And the bone is looking very white, sclerotic, which is a sign of arthritis. And the joint spacing has disappeared. So we're essentially getting at this point, I don't like to say it, but bone right on bone.
Yeah.
And so people who have this issue know that it feels like this cracking, popping, pain, swelling in the morning. And that would be knee osteoarthritis.
Yeah. So basically, tri means three, obviously. So at this point, like obviously, this didn't start this way. So typically, the medial joint line, which is this one over here. So the other knee would be, let's say this is, this is somebody here. One knee was bad, the other one was good. Medial is on the inside, lateral is on the outside. Arthritis typically affects the medial joint line first, and then the lateral, and then, in tricompartmental, the patellofemoral compartment, basically behind the kneecap, it can come at any point. But typically when you're talking about the joint spaces, you're talking about the medial one being affected, the first one, which is why when this collapses on the inside, if it's bad, you'll start seeing people walking bow-legged. All right. So the outside of the knee is jut outwards and the inside is collapsing. So, by the time that the three compartments are affected, you're talking about, either severe trauma or, just something that's gone on for 20, 25 years. And at this point, if you're looking at the right knee, this is a complete knee replacement for sure. Right.
Mm-hmm. Yeah, and so we did have a question about this this condition. The most important thing to do if you are suffering from arthritis in the knee is don't be afraid to move. Motion is lotion, and so the more you move that joint, the more it's going to stay lubricated. The types of recommendations for exercises are low impact. Walking is still good, but they'd recommend a recumbent bike, so a bike where you're not putting as much load on the knee joint, as well as water aerobics or water exercise, because it's non-weight bearing in nature.
Yeah.
So you'll find if you keep the knee moving that the pain will begin to subside just the more that you move it around.
Yeah, absolutely. We just had somebody comment about the fact that they have this type of an issue. Can we send the link for the schedule, Ben? Can you put that for us?
Yep.
So we'll put the link for scheduling there. So I think that that summarizes the tricompartmental aspect of the question. Hopefully we answered that. And then the three types of there's more than three types of arthritis. The first one we can talk about is degenerative arthritis. So a lot of times people talk about degeneration and they start to mention family members. When we're talking about degenerative arthritis, this is not hereditary. Now, it is very common that, Mom can have it and the child has it, or the grandma had it, grandpa had it, and the kids had it. But degeneration is from overuse, or at one point, the other extreme would be lack of use. So very, very common to see degeneration. You can see it in knees, you can see it in hips, you can see it in shoulders. Any joint can deteriorate over time. Um, the bone, can at this point, like when you look at the right knee, it can rub bone on bone. This is a type of degenerative arthritis, right? So what we call OA, osteoarthritis. So that's definitely one of the most common ones that we see. Ben, go ahead with the other ones.
Yeah, and so there's over 100 different types of arthritis, and degenerative would be the most common that we would see in the office based on the population of people. Now, a lot of people say, oh, well, I've had family history of arthritis. Well, here's another thing. So today I saw a desk worker, and she's had the same changes in her spine as another desk worker. And so she says, oh, well, this is just a normal part of aging. But your environment has a lot to do. The environmental stressors, the stresses in your life have a lot to do with the way that the spine and the extremities degenerate. If you do the same occupation as somebody else and they have a shoulder issue, and then you begin to develop a shoulder issue, you're not going to say that, oh, there's shoulder issues in my family. Well, a large impact of that comes from the type of occupation that you do. And so keep that in mind when, you have headaches or you see changes happening in your spine. So
Mhm.
another type of arthritis is inflammatory arthritis. So a healthy immune system is protective, and it generates internal inflammation to get rid of some of the infections that it finds and the diseases. But with inflammatory arthritis, the immune system isn't working properly, and mistakenly attacks the joints with uncontrolled inflammation. And then what happens is it causes the joint to erode. And so inflammation can also attack your internal organs, your eyes, and other parts of your body. So an example of an inflammatory arthritis would be like rheumatoid arthritis or psoriatic arthritis, ankylosing spondylitis, gout. These are types of examples of inflammatory arthritis that attack the joint.
Yeah, another one would be lupus. So when you do your typical, CBC, complete blood count, and your typical blood work, a lot of times they're not going to check for this. So it is something that you have to request if it is a concern of yours to do a specific panel. So for rheumatoid arthritis, you want to make sure that they're checking for what's called a rheumatoid factor. And for something like lupus, ankylosing spondylitis, that's the one where people are hunched forward and the ligament on the front part of the spine is starting to ossify. When you're talking about lupus, one thing that you want to check when you're doing your blood work is for what's HLA-B27, Ben? That's a
HLA-B27 is for
antigen.
ankylosing spondylitis, and it's the antigen. Yeah.
It's an antigen, right? So basically, they have to screen for what's called the HLA-B27 antigen, and if you have that, then that could be a telltale sign that you have an inflammatory arthritis, be it lupus, not psoriatic, right, Ben?
No, not
No.
psoriatic.
So HLA-B27 is ankylosing spondylitis, lupus, and which one else?
Reactive arthritis.
That's right. Cool. So again, not part of your regular uh, blood panel. So you might want to request that if that's, that can be hereditary for sure.
Yeah, and the most important factor with those is, it attacking the joint is one thing, but the fact that it can attack your internal organs and influence them from that way uh, brings it to a new level of severity. And so whenever we recognize a spondyloarthropathy, we're always very cautious. Okay, well, should there be more investigation here?
Absolutely. Yeah.
Now, yeah.
Go ahead.
I was just going to introduce the next type of arthritis. So there's such thing as infectious arthritis. So these can come from bacteria, viruses, or fungus. They can enter the joint and then trigger the inflammation, and then the arthritis ensues. So examples of these types of infectious arthritis are like salmonella, chlamydia, gonorrhea, so some of these STDs, right, as well as hepatitis C. And so if you do have any type of bacteria or fungus, virus, it's always prudent to have the joints checked afterwards, because you could have suffered some damage during that bout.
Yeah. And then lastly, we have metabolic arthritis, which the most common one is going to be gout. And gout basically is your body's inability to break down the uric acid or the purines, and basically you end up with uric acid in your joints, which is very, very, very painful. I've treated a few patients that just got gout, and I had it one time, and this guy had it in the wrist, and it was just bright red, and you could feel the temperature, and it just had a telltale sign of an infection. And definitely at that point you need to treat it pain wise. A lot of times there'll be an anti-inflammatory. Colchicine is one of them, allopurinol. So there's a few things that they do medically to try to alleviate it, but the cause usually comes from certain foods as well. You're looking at red wines, red meats, any hard liquor, shellfish are on the do not eat list when you're susceptible to gout.
Great. So I think that addressed question number one. So thank you so much for the individual, I think who submitted this question, Jeanette, might have been Jeanette. So thank you so much.
Right on. Yeah, that was a loaded question. That was a great question. The next question we had was about PRP. I'll gladly talk about that because I'm actually a patient, and I had a lot of at one point pain in my thumb, and it was the saddle joint right here. And probably from treating as many patients as we treat, the thumb got tired and started to get painful, and saw many people, including chiropractors and all this stuff, that wasn't getting any better. And I started wondering, what am I going to do? And I had read a lot about, platelet-rich plasma and, whether or not there was a lot of research and all that stuff, and realized through my connections that this is something that's, really well researched. It wasn't in the beginning, which is why sometimes you read stuff on PRP and they question whether or not it's helpful. But now it is, and there's a lot of research on it, which basically the process is you have your blood drawn. It ends up in a vial just like this, and then they what's called centrifuge it. So what happens, the red blood cells follow the bottom. You have your platelet rich plasma, and then you have your white blood cells that are in that area as well. They take your plasma and then they inject it in the joint. So what happens is you have your growth factors and you have your stem cells that'll be in this yellowish plasma liquid. And what happens when you're injecting that in the joint, inside the synovial joint or whatever joint you're injecting it in, it'll create an acute inflammatory process, which will get new blood cells to the area. And the stem cells, what basically the stem cell is an undifferentiated cell, meaning that wherever you plant it, it will become that tissue. So if you did stem cell in the liver, that undifferentiated cells become a hepatocyte. So it becomes a liver cell. So it has the ability to become whatever. So for joint, it has the ability to become cartilage, right? So that is very, very important. Now, here in Nova Scotia, and actually in all of Canada, we cannot load the plasma with stem cells. In the US, what they can do is they can take some stem cells, you can freeze them, and then they can basically put them in the plasma. So they stir in your stem cells within the plasma, and the results are actually augmented. But here in Canada, we can't do that. So we can only do the plasma injection. I have to say that since that injection, and this was now about 2 years ago, I have never noticed my thumb again. And I've had many patients get PRP injections in their knees and hips with phenomenal results. And I'm talking about the inability to do a squat more than like 20 degrees coming in the next day, literally the next day, and going all the way down and coming back up. So this is unlike cortisone. For those of you who've had a cortisone shot, there is no side effects to PRP. It's your own blood. It is not a medication. Cortisone has the ability to leash calcium away from the bone. So there's dangers to that because you can actually get regional osteoporosis in the area of the injection. So cortisone, all it does, it's like an anti-inflammatory inside the joint. It wipes out the inflammation. And then down the road, you have the problem once again. And if you don't, great, but that's just not the odds. The odds are that you're going to have it again. So basically, the PRP is very, very helpful, specifically for knees. What I will say is that if your x-ray says severe, you are probably not a great candidate for PRP. We need a little bit of spacing there and some cartilage left to work with. So mild to moderate is what we look for in terms of the level of joint problem that's there on an x-ray. You definitely need the x-ray. Depending on where you're injecting the PRP, sometimes you can do it with ultrasound where you actually see where the needle is going so that you can be even more specific with the injection site. So my experience with PRP has been fantastic, and I at times recommend it for patients that are prime candidates for PRP.
That's a great question because I was also wondering, what's the, severity level, and is it moderate or, severe levels of arthritis? Can we recommend PRP for
Yeah.
most patients? And so that's great. I was curious about that as well.
Yeah. Yeah. So that was the PRP question. And if there's more questions around that, we may actually do an interview with someone who does PRP injections. If you'd like that, just give us some thumbs up and we can definitely hook that up. I was thinking about that, Ben, the other day. So we'd be able to talk about that, and as well as what's called needles, not acupuncture, but
Dry needling?
dry needling. Yeah. So we can, definitely incorporate that and talk about acupuncture as well.
Yeah.
All right. Next
Okay.
question. So, guys, if you've learned something so far, let us know. We hope you're enjoying. At this point, not a bad time to share this episode. So hit the share button, get this out there. And is PRP expensive? It's not cheap for give or take. If you were to do the knee, not uncommon for you to need 2 times, so 2 injections. And you're probably looking at about, it's a guess, but you're going to pay anywhere from $1,000 to $1,500 for an injection or 2, right? Now that's including 2, give or take, $1,000 to $1,500, but better than having pain every day.
Yeah. Or organic. Yeah. Or organic gluten-free alcohol is better to reduce the chance of gout. Yeah. And so definitely better to have something that's free of gluten and that's organic, something that's a little more natural. If you already have, they say if you already have gout and you're drinking alcohol, it won't spike it, but it'll probably increase the pain. It's not going to increase your chances of getting gout, but if you already had it, it's going to increase your pain. So that's the way I'm going to answer that question. So,
Janet, sorry, just one more thing, Janet, regarding gluten-free. I think anytime your body is sensitive to anything, not just gluten, if it's dairy, if it's egg albumin, whatever it is, the body's response to that is going to be inflammation, right? So if you're gluten-free, but your body doesn't react to gluten, it may not have a big, reaction with you, or a big effect. But for somebody who is sensitive to gluten, it's going to have a huge effect. So it depends on what your sensitivities are.
Yeah.
All right.
Good. So Sjogren's syndrome. So this was a great question. So Sjogren's syndrome is an autoimmune disease, and it attacks the glands that make tears and saliva. And so individuals who have Sjogren's syndrome have very dry eyes, very dry tongue. So as you can see in the photo there, the tongue is cracked. So it's very dry. You may experience dryness in other places that need moisture, such as the nose, throat, and the skin. You also may experience pain of the joints, swelling, stiffness, and swollen salivary glands. And so these glands are just behind the jaw and anterior to the ear, right in this region here. And so they may be very painful and swollen. You may experience fatigue as well. And so most people with this disease are over the age of 40, and mostly women. And it's
What's up with
sometimes,
women, eh? Like
yeah,
MS, frozen shoulder. Man,
yeah,
we get off so easy being guys, eh?
we do, we do. And
Oh,
so some of these conditions may be linked with something like rheumatoid arthritis or lupus. And so you have to watch out for a condition such as this. There are some, like, scientists aren't really sure why this happens or people develop this syndrome.
yeah,
But you know, the triggering mechanism, what they're finding is that it's linked with these viruses and bacteria. So
yeah. And vice versa. If you're seeing somebody with Sjogren's, you got to ask the question: is there an underlying arthritic component, right? Because they're linked. That may be a good clue as to checking in for the rheumatoid factor, or checking if they have lupus. Uh, Ben, do you remember what the sign for lupus is on the face?
yeah, it's a butterfly.
Yeah. So basically right underneath the eye, you'll kind of have like a butterfly type of you call it a rash.
Yeah, butterfly rash.
Yeah. So you'll see that in people that have lupus. It's not always present, but it's very, very common. Kind of like a bullseye rash for ticks. They're not always there, and it's not, you can't always go by that, but you'll definitely have that rash on the face.
Yeah, and so for those of you who are wondering, what does this look like? The singer Seal, he had lupus, and so he was left with this scarring after getting the rash. And commonly, people have had it will have this butterfly type rash scarring just below the eyes. So some natural remedies, just to end off with Sjogren's syndrome here. Some natural remedies: use artificial tears or lubricants to help keep the areas filled with moisture. Increase the humidity in your home. Don't smoke because that dries you out. Increase your fluid intake by drinking more water. You can also get artificial saliva. Never heard of this until I looked it up, but you can get artificial saliva to help moisture the mouth. And you can also try a nasal saline spray to get the nostrils lubricated as well.
There's also certain medications that are known for creating a dry mouth and dry eyes as well. They're symptoms of Sjogren's, right? So sometimes if that's happening, you might not have Sjogren's, but definitely check the list of side effects for the medications, and that could be the case as well.
Mm-hmm.
Great question, and we have to dig back to our chiropractic national board days to
Yeah.
discuss Sjogren's.
Take me right back to diagnosis class.
Yeah, I think that was Diane. So hopefully we answered your question there, Diane.
So,
All right.
this is a really fun topic. And so exercise in pregnancy, there was a question about the exercise that you can do to help ease the pain during pregnancy. Yeah, and so basically we're gonna do a more in-depth jump into this topic later on, but just to sort of get people going on this very controversial topic, which, I mean, it's controversial when you get down to the nitty-gritty, but it's about exercising during pregnancy. And so there was a lot of research that was devoted and put into this to determine, okay, is it safe to exercise during the first versus the third trimester? What can we do? So just to get things started, so pregnancy generally is measured by weeks. So there's 40 weeks, or just over 9 months. First trimester is weeks 1 through 13. The second is 14 through 27. And the third is 28 through 40. So changes happen. And that's why we have to keep moving, right? So you have increase in weight, right? You're carrying something on you now. And so the body is going to take on that extra weight. So there's going to be increased joint forces, right? And so what we want to do is be able to distribute those forces properly. Balance changes because now you have increased weight in the stomach. So your center of gravity is going forward. Ligament laxity due to a hormone known as relaxin. And so the joints become very loose. And then an increase in lumbar lordosis. Just because you're carrying more weight in the front, your lumbar spine, your low back, is taking way more pressure than it normally would. Clayton, do you have any comments so far?
Yeah, not a whole lot. One thing that I will say is that, because of the change in balance, it's very common to hear, pregnant moms falling. So you got to be very careful. Like your proprioception, your brain's ability to detect where your joints are is different, right? Your center of gravity changes, like Ben said. A lot of people retain a lot more water. So one of the very common conditions we see in pregnancy is going to be, um, you know, I hate to call it carpal tunnel syndrome, but you're getting carpal tunnel-like symptoms because of the inflammation around the wrist area, the feet. You can also get tarsal tunnel syndrome, where you're getting numbness and tingling in the feet as well. So a lot of changes definitely happen in a short period of time, i.e., the 9 months.
Mm-hmm. And so the benefits of exercise, and now this is something that's new, right? Because we weren't sure if it was okay to exercise or not during pregnancy, and this is like new stuff. They have pregnancy guidelines now. So aerobic fitness is really good because it helps encourage the fetal heart rate response. It can also control your body fat, and so this will also reduce fetal stress during labor. It can prepare. You can also prepare yourself for childbirth by doing exercises pre-childbirth, known as Kegel exercises, for an example. And a lot of women out there are familiar with Kegels. You can also prevent gestational diabetes. So keeping yourself active is going to prevent that gestational diabetes from developing to the child. So improve circulation, posture, core strength, muscular balance, which is super important, and increases in postpartum recovery. So just like post-op prehab, like we call, or prehab before your operation, before pregnancy, doing some pre-pregnancy exercise to help prepare the body for after birth.
A question for all of you guys, and even listeners that are, thinking about having a child, and, how many of you would go out and decide tomorrow that you're going to run a marathon, right? And just say, yeah, I'm going to run 42 kilometers. Well, it'd be ridiculous, right? So to go into a pregnancy and go through labor, which is literally a marathon, been there, done that, saw my wife do it. I'm like, oh my God, to not prepare for that and not do exercises is literally like asking yourself to run a marathon tomorrow without training. So absolutely, you need to prepare for that and do the things needed in order to put the odds in your favor to have a natural pregnancy and have no regrets down the road saying, I should have done that, and know deep down that you could have prevented a C-section or any of the interventions that could happen uh, while you're delivering the baby.
Yeah. Yeah. And so definitely it helps to have this research put out, and it's helped so many women because now they know exactly what exercises they can do and at what points during their pregnancy. And so women can do cardio during pregnancy. Okay. And so what's recommended is 150 minutes per week of moderate level physical activity. And for those of you who are familiar with your VO2 max, that's 70% of your VO2 max. So examples would be a brisk walk, water aerobics, the elliptical. They also say that you can run. Now, they recommend this only for women who have been running before their pregnancy. And so they say, don't get into running when you're pregnant, get into it after. Okay.
Great idea.
Yeah. And then as well, stationary cycling is also recommended. We're going to be doing a more in-depth launch into this later on, but just to give everybody an idea, the biggest takeaway would be to perform Kegels. So if you want to be able to help yourself with urinary, a lot of women experience urinary incontinence, especially after pregnancy. And so Kegels are a way to help with that, to help create strength in your pelvic floor. And for those of you who don't know what the pelvic floor is, it's the muscle group that basically retains all of the inferior portion of the pelvis and all the organs in that area to help keep it together. And so the Kegel exercises, which for an example, the wave or the elevator, it's to help tighten and strengthen that area up. So you can do that before pregnancy and postpartum.
Yeah. And actually, at one point we might be able to interview somebody regarding pregnancy and exercise, right?
Yeah.
Wink, wink.
Wink, wink. Yeah.
Maybe she's
Um,
listening tonight. All right.
I think she always listens. So yeah, we'll be able to do a more in-depth conversation into this topic. But as you can see, there's definitely a lot to talk about, and there should be a lot of questions here. And if you do know someone who is going through pregnancy and isn't sure about the rules and regulations of what it is that she can and cannot do, um, this would be a conversation to share, because we will be doing a more in-depth dive into this topic at a
And
later.
see a chiropractor, right? I've seen so many pregnancies, and most of them, after the pregnancy that they've gone through with chiropractic care, say they will never do it again without chiropractic care. Just knowing the state of the pelvis, the alignment. I don't know if many of you know this, but there is a ligament that goes from the uterus to the sacrum called the uterosacral ligament. And if your pelvis is torqued, you might not even know you have a pelvis that's out of alignment, because you might not have any back pain. But all of a sudden, the pelvis is torqued and the uterus is growing, but the uterosacral ligaments are forcing the uterus to turn, which forces the baby to turn. And now you have a breech presentation, and you're heading into your third trimester. And here they are wanting to do every intervention in the book to try to turn the baby. And the cause of it was a sacral alignment that could have been fixed way before. So it would have avoided all the panic and all the chaos that goes into what I call a medicalized birthing process. So see your chiropractor, and definitely be proactive with this, and put the odds in your favor to have a natural birth, because the benefits of that are just unreal in terms of what can happen to a child versus going through the whole medical process and a C-section, and not just the child but the rehab afterwards. The recovery is just brutal after a C-section versus a natural birth. So great question.
Yeah.
All right.
Yeah, and so it's allergy season. So this was a great question. Yeah, allergies and the sinuses. And so one of the most common allergies that we're seeing these days, and I think this is a really relevant topic, is something called hay fever. And so allergic rhinitis. It occurs during a particular season, and it gets its name from the season where you're cutting hay. So cutting hay season, it occurs when your immune system overreacts to an outdoor allergen like pollen, and it releases histamines, which are inflammatory antigens, into your bloodstream, and they produce the chemical symptoms, the symptoms that you feel, like a runny nose, stuffy nose, watery eyes, itchy eyes, etc.
Yeah. So in this process, we have what's called mast cell activation. And these mast cells are what actually produces that histamine. So, the over-the-counter drugs, the antihistamine, help mitigate this whole, loop of activity that happens chemically in your body. But definitely this year, people are saying that they're a little bit worse, right? So I'm not one that suffers from allergies, but I've definitely had some patients say that they're struggling this year a little bit. And obviously, the areas of pressure are going to be those sinus areas, sometimes with allergies, and typically they go together with sinus problems and allergies, because the allergen, the response tends to affect the sinus cavities.
So great question. The treatment for this is to avoid your triggers. There are medications out there that can also help regulate some of these responses, but the best triggers that we can recommend for you guys is avoid your allergen. If you know that it is, that it is a very gustly, windy day, make sure you close your windows so you're not getting any of these pollen inside of your house. Just ways to avoid it.
Yeah. Yeah, one of the things that I've read lately, and this is something that we had to go through with one of our children, is that with mast cell activation, sometimes what can happen is you could be responding to certain foods as well. So at times, going on a carnivore diet where you're not taking any plants at all for a short-term period of time can stop that mast cell activation as well. And you guys can look up this, just another conversation for another night, but the carnivore diet It can be done on a short-term basis to stop that mast cell activation. And you might find out that, yes, allergies are affecting you, but there could be other things that are creating that mast cell activation that's become chronic over time. So just no pun intended, but food for thought.
Hmm. Great.
Can chiropractors help with allergies at all? Well, here's the thing, right? We do not treat conditions. Have I heard patients anecdotally say that, their allergies are not as bad as what they used to? Yes, and I think that's a reflection of their entire body being healthier. So, along with chiropractic care, we will recommend, certain dietary changes and stuff like that. So it is a multifactorial approach. And I think that's the result, or sorry, their allergies not being as bad as they used to is a result of the many things that we may have been telling them to do, and not just, the chiropractic, alone. I want to make sure that I stress that we don't treat allergies. But yes, I have noticed that certain patients have said that their allergies aren't as bad as they used to, and attribute that to chiropractic care. So great for them.
Yep, that's a great answer, Clayton. I think we're set and we're good to move on to the next one. So, question number 6. Great question. Is it a good idea to take calcium supplements the same as vitamin D? So I'll just sort of start it off just by doing a little intro. So calcium is a mineral that the body needs for good health. It's found naturally in some foods, and it's available as a nutritional supplement, which we'll get into. How calcium gets absorbed into the body depends on the form of the supplement, how well the calcium dissolves in the intestines, and the amount of calcium that's in the body at the time. Because if you already have enough, it's not going to absorb too much. The two most common products of calcium are calcium carbonate and calcium citrate. So calcium carbonate dissolves in an acidic environment, so it dissolves when you eat your food, whereas calcium citrate, you can take it at any time. You don't need acid to dissolve it. And so there are different types. And is it a good idea to take calcium supplements the same as vitamin D? And Clayton, I'll let you take it away from here.
Well, there's definitely some issues with taking calcium. I'll get the question sometimes. People will combine. I'll get away from vitamin D for now, but many times calcium is combined with magnesium. So people take a Cal Mag. If the reason you're taking the Cal Mag is to get some magnesium, there's definitely not going to be enough magnesium in a Cal Mag supplement to get the effects that you want from magnesium. Um, for me personally, there's been some research that says that taking calcium can be a risky thing, because it does affect the prothrombin, which basically is what is prothrombin?
It helps with clotting.
Yeah, I'm trying to think of what it is though. I guess it's not an antigen, but
Protein.
protein. Yeah. That basically affects your clotting time. So basically, what can happen when we take too much calcium is you can have an issue with your heart. So it's something that you want to be careful taking. My take is that there isn't any research that says that you can take too much calcium from food. And the issues around calcium with the heart are from taking calcium from supplements. So it's always safer to get your calcium from food versus taking it from a supplement.
Mm-hmm. Yeah, and that's exactly what the current research is saying now, and it's important to have that taken of calcium, because when we think about how important calcium is in maintaining healthy bones and strong teeth, it helps protect against osteoporosis. But it also plays a key role in helping activate your neuromuscular junctions. So it influences the way that your heart and your muscles contract and beat, in addition to nerve conduction. And so it's a very important mineral to have in your body, and be able to take in. Now, one thing is as well is that if you do have low levels of blood calcium, and so if your blood calcium levels are low when you go to get these levels checked, your body will react. It'll release something called parathyroid hormone, released by your parathyroid glands. And this will cause the calcium from your bone to then enter your blood more readily. And that's how this process of osteoporosis starts. And so when you have low blood calcium, all the calcium from your bone goes into your blood and gets used up there. And then there's a loss in the bone and the osteoporosis ensues. And so you always want to check to make sure that your blood calcium levels are at a normal level. And if they are, you want to get that back up.
Yeah. One thing I'll say is that, calcium has been over advertised in terms of bone density. You got to realize that, there's 13 minerals in bone, right? So calcium is just one of those minerals. So to just go out and say, okay, well, I'm going to take calcium because I have osteoporosis, it's not the whole picture. So, taking your calcium from dark leafy greens, like if you take a look at this chart, a lot of the things you'll see is dark green. So your collard greens, your broccoli, your kale, and I know sometimes some people don't like kale, and you got to kind of hide it in certain shakes or whatever. But this is where you are going to get your biggest source of calcium. And I know some of you might like milk, but milk is not the best source of calcium. You have to realize that milk is the number one allergen on this planet. And we're the only species that drink milk after being born and being breastfed. We go to water. Every species on this planet goes to water. We're the only species that drink milk. And not only do we drink milk, but we drink it from another species, being cows. And cow proteins are very big, and they don't cross our membranes very well and can stimulate our nervous system, our immune system, and specifically our mucus glands. So we got to be careful with milk, specifically if you have an intolerance to milk, and not just the lactose intolerant, but the actual milk protein, right?
Mm, yeah, and it's definitely one of those things that that's come up in the recent literature, especially with this food movement that we're going through, where dairy just isn't what we thought it was.
Yeah.
It's just like, I was gonna say, it's just like in cod. You see that photo where it's like in cod we trusted.
Yeah.
You ever see that?
Yeah.
In milk we trusted.
Yeah.
But yeah, so great question on calcium. So always check with an expert before you take any supplements. That way you are 100% understood,
Yeah.
and you know what it is that you're taking and that it's the right quality. And we talk about this all the time with the quality of the supplement will determine the quality of the effectiveness. And so you have
Yeah.
to be able to know that.
And no, we do not get enough magnesium. Magnesium is the one that's really being promoted right now. And, we're kind of depleted at all levels right now with, stress and everything. And magnesium is winning the race right now in terms of the most popular supplement out there. And again, we talk about quality of the magnesium we're getting. A lot of people are taking magnesium and say, oh, I didn't notice anything. And when we dig a little bit more, we find out where they bought the magnesium, and then that kind of answers the question as to why they didn't get the results. Quality is everything with magnesium, and magnesium has made me look very good many times with my patients that I've recommended, and they're like, "Oh my gosh, my energy is up, mental clarity is up, everything, focus." Magnesium is phenomenal, and you can't overdose on magnesium, but the only effect is going to be loose stools. So if you get a little bit of diarrhea, you're taking too much magnesium, because it's a natural muscle relaxer, and it can have that effect on digestive muscles as well, right?
Yeah.
Intestinal muscles.
Yeah, most people don't get enough of a lot of the supplements that they need, and namely is vitamin D. And so making sure that you're getting enough sunlight, and it'll have a lot of positive effects. And they've seen a lot of people who have seasonal affective disorder are reduced in their vitamin D intake.
Yeah, absolutely. So let's pause right now and give people a chance to pay their admission fee to this show, which is sharing this episode. So if you haven't done so yet, please go ahead and share this episode uh, with people. We appreciate that very much, to get the word out there about what chiropractic care can do, and not just chiropractic care, but some of these questions that had tonight, nothing to do with chiropractic, but might help some people with some of the things that they're experiencing. So thank you for all your shares so far, and we really appreciate this. Go ahead, Ben.
Yeah, I was just going to say, you know, some of these topics, what I really love about question night is that it gives us the opportunity to talk about things that we don't normally get to talk about. And you just never know who the next person is that might see Sjogren syndrome, you know, and might say, oh, I have that. You know, I've never heard anybody go live and talk about that condition, you
Yeah.
know, and so you're really doing something special for people who are out there and maybe looking for questions to be answered, or just looking to know that there's people out there who are talking about the conditions that they have. Before we did these hump day conversations, I don't think there was really anybody else uh, on your Facebook feed that was doing these types of conversations. And so it definitely gives us the opportunity to open people's eyes to maybe the conditions that they have or something that they're just curious about.
Yeah. So we'll end tonight with CoQ10. I actually got a few questions this week regarding CoQ10. And this is a supplement that we talked about last week about anybody who's on statin drugs. Statins have a very common side effect, one which is muscle tightness. And statin drugs are the Crestor, Zocor, Lipitor. And one of the things that they do is they basically mess up your part of the mitochondria, which is the energy producing part of your cell. And CoQ10 helps replenish that. So a lot of research on CoQ10 and the effects of statin drugs out there. So this is not something new. It's something that most medical doctors do know because it's been in the literature that if you are on statin drugs to take CoQ10, it's a very, very, very potent antioxidant. And antioxidant means that through an reduction oxidative reaction has the ability to kill free radicals, and free radicals lead to cancer. So antioxidants and the amount of antioxidants that we take in, either through food or through a substance called CoQ10, are putting the odds in our favor that we're doing what we can to minimize potential problems down the road. So a great antioxidant, CoQ10. I can't say more than that. It's just it's great.
Yeah, I mean, I recommended this one today to a patient as well. So I just love the way that how supplements they just complement what it is that we do as chiropractors so well, and that's why we're always on the search to find the best supplements out there.
So again, we want to thank you guys. If you haven't shared the episode yet, please go ahead and do that. Thank you, Kathy. Share. We can't say that enough. And if you're watching us on YouTube, make sure you hit the subscribe button. And that way you can be notified when we have a new episode that we've posted. This episode will be posted tomorrow morning on YouTube at 8 o'clock. So we love you and appreciate you as always. And as always, Ben, any final thoughts?
Keep on rocking in the free world. We are doing great. We're almost at the end of May. We're into June soon. So guys, keep moving forward. Keep making the little steps towards a healthier lifestyle, a healthy life, creating healthier lives for yourselves and for others around you. Yeah, so that's my final thought.
We are getting through this, guys. Pretty soon we'll have summer and we'll have people that we can hang around with. So again, thank you so much. Thank you for being live with us. And we look forward to seeing you again live next week on Hump Day Conversation number 26 at 9 o'clock next week on Wednesday. Take care and have a great night.
What's up, guys? Listen, if you like this episode, you'll probably like the other ones. Chances are pretty good, so here's what you need to do. You need to like us and follow us on Facebook. Following means you get notified when these two guys are live. Next, family, friends. You need to share these episodes because you never know. You might help them because they need this information as well.
And guys, if you ever miss an episode, make sure you subscribe to us on YouTube. That way you can watch the episode over and over and over again.
Guys, we love you and appreciate you.
Take care.